Hi, I'm Laurel Lewis, and today I want to talk to you briefly about when is it time for hospice? How do you know when it's time to refer somebody to hospice services? I get asked this question often, and the answer is mixed. There's a variety of reasons why a patient or a family may choose to investigate and acquire hospice services. One of them is that the patient may simply be done. The patient may feel complete. That's a term that I use when a patient has reached some resolution in their body and in their mind, and they just want to go. They just want to be done. They feel complete with their life and are ready for that last phase to begin. Oftentimes this can be disconcerting for the family who has been involved in some kind of struggle or fight for life. The patient will let you know when they're done, when they're ready. Sometimes it's just that they're tired, or we might say that their soul is tired, that they just want to go home and rest. And this is the number one reason I think that most people sign on to hospice care, because the patient is complete, or their body is telling you that it is complete. Which leads us to another reason why someone may choose into hospice services, is that the treatment that they had been receiving is no longer effective. The treatment plan is failing for a number of reasons. It could be that the organs are shutting down. It could be that the treatment is simply no longer effective. It could be that the treatment is creating some cost to the patient, whether that's a physical cost or an emotional or spiritual cost that they are not willing to pay anymore, that the benefit of the treatment is not worth the cost to the patient. And how do you know? How do you know? What does this look like? It's easy enough to say that these are some of the reasons, but what it may look like is that there are repeat ER visits, to the emergency room, to the emergency department, that you are finding the patient and the family in the ER on a near monthly basis, or every couple of weeks, or maybe every couple of months. And that could be for infection, it could be for breathing problems, it could be for hydration issues or electrolyte imbalances. Many of those things can cause an ER visit, and that's okay. It's fine to use the ER, but when you notice that you're using the ER on a regular basis for a patient that may be in their late 80s or 90s, it may be time to start asking more challenging questions about why do we keep coming to the ER? Can we cause more comfort or create more comfort for this patient in the home environment? And start a dialogue with your physician. Oftentimes physicians are reluctant to relinquish the patient to the hospice program, to hospice services, because they may have developed a quite meaningful relationship with this patient and might feel that signing on to hospice is a failure in some regard, which we know that it's not. We know that every patient that goes into a doctor's care will eventually find their end, and that if a physician and a patient and a family can open up dialogue earlier, that more patients can take advantage of the hospice services that are out there. And if you have any questions at all, don't hesitate to simply call up your local hospice to ask them questions and discuss the prognosis and find out if it's appropriate. Oftentimes we see patients on hospice where our first visit to meet the family is our last visit, that the patient is actually dying at the time of admission. And that's part of the reason that I have offered some of these videos, is so that people can get better educated about what hospice is, when it may be time, and what happens under hospice care. So if you have any more questions, don't hesitate to check out my website, laurellewis.com, and have a very blessed day.